Good afternoon, everyone, and thank you again for joining us for today's webinar, Ending Hunger at Home, Housing and a Last Mile Approach to Addressing Food Insecurity. Today's presenter is Jennifer England, Program Director of Food Recovery Operations at 412 Food Rescue. Jennifer comes to 412 Food Rescue with experience in several sectors. After pursuing a PhD in history, she switched gears and worked in communications for more than a decade. Putting her storytelling abilities to work, she served as a media consultant working with businesses, advocacy groups, unions, and nonprofits, helping them tell their stories to media on a local and national stage. Jennifer has also dedicated herself to justice and the community through board service for a number of amazing organizations, including the League of Young Voters, Best Buddies Foundation, Grow Pittsburgh, New Leaders Council, and several board committees for the Greater Pittsburgh Community Food Bank. She also co-founded the nonprofit project On the Spot to supply feminine hygiene products for girls in local schools who struggle to meet this need. In her off hours, she is a passionate food enthusiast. Her work as Program Director of Food Recovery Operations at 412 Food Rescue combines her passions for food, economic justice, community service, and environmental responsibility. Thank you, Jennifer, for joining us today, and I'll turn the presentation over to you.
Hi, thank you so much. Welcome, everybody. Thank you for being here. I want to start off by saying that I am fighting a summer cold. I will do my best not to sneeze, cough, or blow my nose during this presentation, but no promises. She's already read you my bio. I'll say that I am in charge of food recovery operations at 412 Food Rescue. We began in 2015, and it was really just several of us picking up food with our cars and taking it to wherever we could find. Since then, we've grown. We just surpassed our 4th million pound rescued, and we now have a variety of other projects that we work on as well. I want to talk today a little bit about how to end hunger by partnering with housing sites, or if you're a housing site, by partnering with other organizations. But I want to start by talking about food waste, and it may seem that they're not related, but bear with me for a minute. Currently, we waste 40% of the food that we produce in this country and worldwide, and that is the majority of that happens after farm and factory production. So 80% of that food waste happens once it leaves the factory, once it leaves the farm. And a majority of that happens at consumer-facing businesses, which simply means it's not in the household and it's not in the factory or the farm. So we waste about 40%, about 42% actually, of that food as well. What that means is that we spend $218 billion a year growing, processing, and transporting food that's never eaten. To make it worse, that food, once it gets into a landfill, is actually an environmental hazard. Anaerobic decomposition in a landfill produces methane gas. If food waste were a country, it would be the 3rd largest producer of methane gas in the world. As many of you know, that is a large contributor to global climate change. So not only are we wasting energy, wasting resources, and throwing away all of this great food, but then it is causing problems for us while it sits in the landfill. Meanwhile, hunger is an issue, and there's a lot of conversation about hunger. But in reality, as the Rockefeller Foundation noted recently, if we don't do a better job of eating what we grow, more food production, no matter how achieved, will just lead to more food ending up as garbage. So simply buying more food or producing more food is not necessarily the best approach to ending hunger. In terms of hunger, and a lot of you, I'm sure, know quite a bit about this, 1 in 7 people in our country are food insecure. That's an overall number. It is, of course, much higher in certain segments of the population. So when you look at households with children, the number grows to 1 in 5 households are food insecure. And single-headed households, single female-headed households, it's 1 in 3 are food insecure. For seniors, it's also a big problem. In Pennsylvania, there's 300,000 Pennsylvanians that are food insecure, seniors that are food insecure, and that causes problems for seniors. Food insecurity among seniors can increase their chance of depression, asthma, heart attack, and congestive heart failure. And of course, for everybody, food insecure causes problems. For adults, it leads to bad health outcomes like diabetes and high blood pressure. For children, it can lead to developmental delays and problems in school. And yet, we're doing a better job of feeding landfills than we are of feeding people. Meanwhile, our approach to hunger hasn't changed much since the 1970s. Now, in the 1970s, late 60s, 1970s, we really took an innovative approach to solving hunger, and the food bank system was created. And the food bank system, since the 1970s, has been instrumental in making sure that Americans who are food insecure have resources. However, the system hasn't changed significantly since the 1970s. And the way the food banking system works, and I'm sure a lot of you know this, is that food is picked up, either purchased or donated from farms and from manufacturers, transported in a tractor trailer, taken to warehouses, transported from warehouses, also in trucks, to food pantries, and then from food pantries to individuals' families. And it's been a very efficient way to reach a lot of people. However, access to food insecurity isn't just about affordability and presence in the community. It can be about transportation, time, and even energy. So if you think about a single mother, for example, who has a 1 in 3 chance of being food insecure, she may not have a car. She may be taking public transportation. She may have to take her children to daycare or to school and then go to work on public transportation and then get back and pick up her kids and then get home and get dinner ready and get everybody ready for the next day. That leaves her very little time, very little energy to approach feeding the family. I know that I was a single mother for many years, and I had a good job and a car, and I still would get home exhausted and find that feeding my family could be a challenge. If she has to go to a food pantry and make sure that she gets there during the window that it's open, that can be an even greater challenge. For seniors, a store or a pantry within walking distance can still be out of reach. Many seniors face ambulatory issues, and while our programs, Pittsburgh has a program called Access where seniors can get a ride, it is still not a perfect system and can mean that food can be out of reach even when it's in the neighborhood. And of course, the same thing is true for people with disabilities regardless of their age. They face barriers to accessing food no matter how close it is. And then the food pantry system can be problematic for families, again, that have time crunches or mobility issues, and that food pantries are often only open once a month, or even if they're open more, can only be accessed once a month and currently provide mostly non-perishables, especially if you're only picking up once a month. Any produce or perishable goods that you pick up are only going to last at the beginning of the month, and by the end of the month, you're really going to be struggling to fill that gap in your diet. So the question is, how do we take our approach to ending hunger from the 1970s into the 21st century and beyond? And that's where food waste comes in. A 15% reduction in food waste could feed 25 million Americans. If we take that food that is currently being thrown away but is perfectly good, and instead of throwing it away, we get it to people who are hungry, we can end hunger. But there's a challenge to this. It sounds like an elegant solution, but it can be very difficult. There are a couple of challenges. First of all, food waste happens in a highly distributed network. So these little blue dots, when we do this presentation in person, we ask if anybody knows what these blue dots are. And there's always a bunch of guesses, but people rarely get it. What they are all the Walmart locations. So if you think about Walmart and its presence in communities, it's usually not the only store. There's also Targets and Giant Eagles and Shop and Saves and Kroger's and Acme, and each one of those stores is wasting food every single day. As much as a couple 100 pounds a day of food is being thrown away. However, most of that food is highly perishable and healthy food, the food that's difficult for people who are food insecure to access. That's one of the reasons why it's being wasted. If you have, if you're pulling produce off of the shelf daily because it's not quite perfect, it's not going to last more than a couple of days. So you've got food waste happening in this highly distributed network all over the country, hundreds of pounds at a time, not thousands of pounds, maybe hundreds of pounds, and it's fresh food that needs to get where it's going really quickly. Unfortunately, the current model of warehouses and tractor trailers and distribution to pantries doesn't work for this kind of food waste. It's not appropriate for smaller quantities of food, for food that needs to be consumed right away, in other words, it's going to go bad, or for unpredictable frequencies. Because the other challenge with food waste is it's not predictable. Many stores know that they will have some waste, but they don't know how much and they don't know what. So you can't really necessarily rely on it. And that's where 412 Food Rescue came in. 412 Food Rescue was founded in 2015 to bridge the gap between the 40% of food that is wasted and the 1 in 7 people are hungry. The first challenge is how do you deal with that highly distributed network of food? A truck doesn't work. You can't send even a box truck to 100 different locations a day to pick up 1 box of food, 5 boxes of food, smaller amounts. So 412 Food Rescue instead relies on volunteers. We have a network of over 1,000 volunteers that help us rescue food in smaller amounts. Sometimes it is an entire car full of food. Sometimes it is 1 box of food. Either way, it is a perfect solution to the problem of a highly distributed issue of food waste. The unpredictable nature of food waste is also a problem, though. So many of our food rescues are scheduled. A lot of grocery stores know, for example, that every day they will have food waste. And we have a volunteer that is scheduled, for example, every Monday. Volunteer Sue might go to her neighborhood Giant Eagle and pick up whatever they have and take it to the nonprofit partner in her community. However, a lot of food waste happens on the spur of the moment. It is a catered event that only half of the people showed up for. It is a grocery store that just has a lot left over because maybe there was a snowstorm that week and people didn't go in to purchase, or maybe they over-ordered for a holiday and they have a lot left over. So we use technology to deploy those volunteers, and that helps with the unpredictable nature of food waste. We developed an app. In 2016, we deployed it. It's our Food Rescue Hero app, and what it does is it works very similar to Uber. We see that there's food waste, and we match it to a nonprofit partner, and then we list it in our app. It sends out a notification to our volunteers that are nearby. Whoever's available can hit accept and pick it up and go. It is an amazing way to harness the power of a whole lot of volunteers to solve the issue. But an app isn't necessary. We've also began by using Facebook and using text message and using old-fashioned means to deploy volunteers. Technology doesn't have to be the fanciest toy on the block. It can also just be the social media platforms that we are all familiar with and using. However, quickly we ran into an unanticipated problem. We still were running into the fact that our food was, number one, not getting to places quickly enough. So if you have milk that is dated for today or fruit that is still good but it really needs to be eaten today or tomorrow, it's perfectly right, taking it to a food pantry, which may not have distribution for several days, is not always a great solution to that problem. Similarly, other nonprofits that are food insecurity nonprofits like soup kitchens and shelters, we were overwhelming them. The quantity of food that was coming in from these new sources was just massive. And the organizations that had existed for years to address the hunger gap already had sources of food, and they just could not handle that influx. So we had three problems really. One, our food was needed to get to people much quicker than it could through the traditional system. Two, the traditional system was being overwhelmed by the amount of food. And three, there were still people who were not able to access food. Hunger is not solved. So we had to rethink distribution models, and we wanted to put food within reach of people who needed it. So since that time, we've expanded and distributed to over 450 nonprofit partners in the Pittsburgh region, and about 75% of those are not traditional hunger-fighting organizations. This network puts 400,000 people within a 15-minute walking distance of food access. And our new food access points beyond existing pantries have put food in reach of 100,000 more people than were previously served within a 15-minute walking distance. So we actually did a GIS study to look and see where we were able to expand food access. And you can see by this map all the bright green areas are areas that previously were not within a 15-minute walk of existing food access points. And these are ones that we have activated since we've expanded our network. We're looking to expand beyond that to look for places where there are high-density food insecure individuals and families, but no food access. So we're really trying to take a measured and thoughtful approach to food access. And the links to this study and some others that I'm going to talk about are available on the last slide as well if you want to take a deeper dive into looking how we've managed to do that. So our goal was to switch from this model where we're distributing to a third party to this model where we are distributing directly to people who are in need. Early on, we were approached by the Housing Authority of Allegheny County, and they were interested in looking to see how we could work with them to address food insecurity in their communities. About 6 months later, after we piloted with them, the Housing Authority of the City of Pittsburgh came on and partnered with us as well. Through them, we've been able to really create these new food access points by taking food directly to housing sites, to the communities where there are people who need that food. We have served 185 senior sites and 121 family sites, not just in Allegheny County, but also in Washington County, Westmoreland County, Beaver County, Butler County, and Fayette County. We've delivered about 2 million pounds, or about half of what we've delivered has gone solely to these housing sites. Many of them are housing authority partners, but many of them are not. So we also work with service providers that provide service in the low-income housing, everyone from Presbyterian Senior Care, Arbor Management, American Healthcare Group, and a variety of others that are providing services to these sites, as well as working directly with the housing sites themselves. So what we're doing is we are delivering food directly to the housing sites so that people in those sites can access that food where they live. Seems to me there's something missing from the slide. I'm not sure where it went and disappeared, but we have several tenets that are really important to us in working with these sites. And the first is that donations are placed on the need and the size of the partner location. So we are not trying to dump food on anyone. A lot of times, I think one of the early models that we saw was that people were delivering food, but they would say, you have to take everything we have, and we don't do that. We make sure that the food we're taking is appropriate for that size of that location. If we have a site that has 500 families, first of all, we're not going to take them a tray of sandwiches because that just doesn't make sense. That leads to some bad feelings. And if we have a site that serves, 12 women in recovery, we're not going to take them 200 pounds of cucumbers. So we really make sure that we are matching the food type and food size with the partner location. And then it's always opt-in. We do not force our partners to accept food. We always make sure that the food that we are delivering is something that they are interested in receiving. We also provide best practices to the housing sites so that they can distribute the food. Now, we don't distribute the food. We do not set up a pantry or a food distribution on site. We leave that to our partners. However, we do help them by providing best practices. Each site, though, has the flexibility to empower resident volunteers and to meet the individual site needs. So some sites have a very strong volunteer organization, and it's entirely run by residents. Others have a staff member that helps them do it. We do strongly encourage residents to volunteer. It provides benefits beyond just the food when they do. We also recognize and honor our partners as critical members of our operation. So, it's obvious that our food donors are important parts of this puzzle. I think that a lot of organizations spend a lot of time recognizing their volunteers, as do we, but we recognize that our housing partners are going above and beyond their original mission to distribute this food. They're as important to us as our food donors and our volunteer partners. And so we spend a lot of time working with them to make sure they're getting their needs met and that we recognize that the role that they're playing. Since we began working, we have made a powerful impact in the housing sites that we serve. In 2016, we received notification from the Housing Authority of the City of Pittsburgh that we have effectively ended hunger in their public housing communities. Previously, they were receiving an average of 5 to 7 emergency referrals for food per month. So there would be a family in one of their communities or an individual that had no food in the house, and somebody would call the office and say, there's this food emergency, and they had a fund that they used to make sure that that person had food provided for them. Since we started working with them, they have not had a single referral for lack of food. Not one, and that continues to this day, to 2018. We have really effectively ended that emergency hunger issue in the Housing Authority of the City of Pittsburgh sites. And it's not just the housing sites that express satisfaction with our program. We actually partnered with the University of Pittsburgh researcher to try to make sure that we were having the impact that we wanted to have. And so we did both a qualitative and a quantitative survey. We found 100% of the residents that we interviewed, and there were 300 of them, said that they strongly agreed that they were satisfied with the food provided by 412 Food Rescue. A researcher said that she has never seen a result like that before. That is entirely unique. There's always some skew if the poll participants think that they should answer positively, there might be a skew, but she's never seen it 100%. So we really feel that the impact of bringing food into communities is something that is very powerfully positive for those communities as well. And we do hear that from people. In our qualitative research, we had a lot of positive feedback. People relaying that the food that we deliver does in fact help them make it through the month. That without that food, they would oftentimes really be struggling to make ends meet. Beyond just helping them to make ends meet, though, we're providing food that can be really hard to access for people who are food insecure. If you remember several minutes ago, we talked about the fact that food waste, oftentimes what is wasted is highly perishable and also highly desirable types of food. Well, 87% of the food that we rescue and provide in housing is fresh, perishable food. It's produce, It's dairy, it's meat, it's bread, and ready to eat, which is often high-quality prepared food coming from universities and restaurants, and those go to appropriate programs. So food waste and food rescue not only helps fill the hunger gap, but it also provides really healthy, nutrient-dense foods that can be really difficult for people who are food insecure, who are living in food deserts, or who are struggling to make ends meet, really need. In fact, we found that a large percentage of our respondents to our survey either agreed or strongly disagreed that they ate healthier food. And in fact, the disagree comments were often things like people who commented that they already were eating very healthy. And the comments bear this out. People talk about eating more salads. There were several individuals who really highlighted the fact that their doctors were telling them to eat more produce and eat healthy, but they weren't able to do that without the assistance 412 Food Rescue provided. We actually spoke with some of the staff members at one of our senior high-rises, and she relayed the anecdote that a resident there had high blood pressure and pre-diabetes and really received some stern warnings from her doctor. And since we started taking them produce, she had lost 30 pounds and gotten her blood pressure and her pre-diabetes under control. So that influx of fresh food really makes a big difference in health outcomes for those residents. We also found that people were happy that they were able to make more choices about the type of food they ate, and that they would try new food. There was a study done recently that food waste actually is really preventing families that are struggling to make ends meet from trying new foods. For example, if you have let's go back to our single mother with several children, and she wants her kids to eat healthier. Well, let's say she wants to try quinoa because she's heard it's a superfood. But what if her kids don't like it? She's now just spent part of her monthly food budget on a food that her kids won't eat. She doesn't have the resources to replace that. So by providing lots of foods that individuals maybe have never tried or were not familiar with, or that their kids had never tried, that they could now introduce them to those foods without the risk of spending their monthly budget on those items. Our comments bore that out. I think my favorite comment ever was the one about the golden kiwi, the woman who said that she'd never in her life seen a golden kiwi and she's old. We also had lots of comments from other people talking about the fact that they're trying different foods and that they're able to get things that they otherwise couldn't afford to buy. And, of course, it saves them from having to take the bus to get food or call Access and spend a lot of time, spend their resources. So, again, those are things that we talked about earlier being barriers to individuals in either improving their diet or accessing food. Having food distributed right within the community in which they live provides all sorts of additional benefits. And then finally, we asked whether or not the food that we provided allowed them to put money elsewhere. And one of the things we found is that people were really reluctant to talk about this. I think they potentially felt like their benefits might be reduced if they said that they were able to spend money on getting something for the kids or getting their hair done. But we really value the quality of life improvements that this could potentially provide to people, whether it's paying for a child's field trip at school, or being able to get a haircut or pay for their phone bill, being able to put their resources somewhere that they would otherwise not be able to put them is a real benefit. And those are the type of things that actually can help improve people's overall lives. We found that the volunteers, and I talked earlier about how we really encourage the residents of the communities to participate in volunteering, they also expressed a high degree of satisfaction, especially in the senior high-rises. A lot of these people have, worked their entire lives, and now they are, looking for something to do, something that makes a positive impact on the community. They maybe have limited mobility, but they can get down to their community room and they can help put strawberries in a bag to hand out to their community. And our volunteers at our sites are extremely passionate about 412 Food Rescue and the impact it has on their communities and the impact it has on their life. I'm sorry, some of my pictures did not render correctly here, I see. We also found that it increased a sense of community, and that's something that we asked about after our initial interviews, because we found that there was a lot of stories coming out of the communities that we serve about how the food distributions were having all of these ancillary benefits. So, for example, you would have, like as this quote shows, oftentimes a senior woman in the community, especially in the family communities, all ages community, that would know how to cook. And if there was something that came in that was large or challenging, like a large cut of meat or a whole lot of squash, sometimes they would actually take that and they would break it down and they would cook a community meal, and they would either hand it out to the families in the community so that they had some to take home, or they would all sit down and have a family-style meal together. We've also heard other anecdotal stories that confirm this. So, for example, the Housing Authority of the City of Pittsburgh, Michelle Sandage, told a really amazing story about being at a distribution in a site with a lot of refugees from Africa, and there were large sacks of potatoes that had arrived, and they were carrying them on their heads back to their house, and they were showing the rest of the community how to carry the bags of potatoes on their head. And so it really built that community collaboration in a way that was really powerful to watch. We also had a story about a young mother who received a roast beef, and she had no idea what to do with it. She'd never cooked anything like that in her life, and so she asked some of the other older women at the distribution what to do with it. And they gave her instructions, and she took it home. And she came back the next day, and she had pictures on her phone of this roast that she had made. And she was so excited that she had been able to do that herself. She had never cooked anything like that in her life. And not only that, but it was going to last her family for several days. So the community building aspects of having that food in the community and the distribution within the community are really powerful side effects that I think all of our partners have reported back to us is something that wasn't anticipated and is really profoundly appreciated. So currently, 412 Food Rescue is operating in Allegheny County and the 5 collar counties around us. There's an organization starting in Philadelphia, Philly Food Rescue, that will also use our app. So housing sites near Philadelphia, that's an obvious partner. So I think the obvious question for people on this webinar is, how do you do this? What do you do if you don't live in our area? And there's a couple of answers for you. First of all, find a nonprofit partner. A lot of food banks are actually doing more food rescue now. Talk to your local food bank, talk to your local food pantry, if there's not a food rescue organization in your area, and see if they want to partner. It was the Allegheny County Housing Authority that came to us. So they were really the ones that set this ball in motion and had this vision of how we could use food rescue to help their communities. Churches are often doing this on sort of an informal basis with a local grocery store. Ask them, instead of distributing from their church, would they be willing to bring it to the senior high-rise or to your family center? Oftentimes, scouting troops or other groups are looking for long-term volunteer projects. This is something they might be interested in. Or do it yourself. If you, as a housing provider, can go and talk to a potential food donor in your area and get them to agree to donate, try to find somebody in the community that can serve as a volunteer. Like I said, we use community volunteers to distribute in many, many of our sites, and it's a really amazing opportunity for everybody at that site. There's no reason why, as a housing site, you could not take the initiative and go talk to a grocery store yourself. And we're happy to provide best practices. We have a packet that we give to our housing partners when we start a distribution there, and it has a lot of great information on how one should go about distributing food. So we're happy to provide those resources as well as give you some of the resources that you may need to talk to a nonprofit partner. And finally, also, if you have a food rescue organization nearby that might be interested in using our app and working with us to expand their capacity in your area, we would be happy to talk to them as well. So our last slide here, I have links to the research. If you're interested in some of the data behind this, you can go on our website and take a look at that. And I see some questions popping up, so I'm going to go ahead and start answering these. Can people see the questions, or should I read that out loud as well?
I can read the question out loud, and then if you want to respond out loud, they can't see
Okay.
the response as well.
Great.
So we had a question from Melissa come in, and she was just wondering that they've experienced some obstacles when they face trying to connect shelters with grocery stores around legal and liability issues. What does insurance liability look like for drivers? What happens if they get into an accident? And for families receiving the donations, what if someone gets sick after eating the food?
Sure. Those are great questions. So first of all, the Bill Emerson Good Samaritan Act at the federal level protects donors. So there is a federal law that basically says if you donate food in good faith to help people who are food insecure, you are protected from liability. There's also a similar state law in Pennsylvania, so there are two levels of protection. In terms of food safety, we are very, very concerned about food safety. Everybody on our staff is ServSafe certified. We have a mobile food safety training that our volunteers go through. It's super simple. There's not a lot that volunteers need to know, but it does go over things like, not transporting food next to cans of paint and, taking food directly to its drop-off. We also work with our nonprofit partners to provide food safety training for them as well, so they know what the basic problems are. But I would say if you are rescuing whole produce and bread, there's very little safety concern. Same thing with most dairy products as well. The time that the food is out of refrigeration is no more than it is if you go grocery shopping. Sometimes it's less because we're really focused on getting food somewhere close by. So if you've ever, gone grocery shopping and taken food home, you basically are doing the equivalent of a food rescue. In terms of the safety for the the liability for volunteers, we have them sign a waiver at the beginning to make sure that they are, volunteering and acknowledging that the standard risks of driving from point A to point B exist, and their insurance should cover it.
Great. If anybody has any additional questions, you can ask them via the phone by pressing *7 on your phone keypad, or you can write them in the chat box.
And I will say the first question we always get from donors is, are they liable? So the Harvard Food and Policy Law Clinic has the information on the Bill Emerson Good Samaritan Act. You can go on their website and download that, and that is the first thing we do to any donors that might be hesitant to participate, is to give them that handout.
Great. And so, we still have a couple of minutes for questions. So if anybody has any questions, we just got one. So where are distribution sites beyond housing authorities, and how frequent is distribution at any one site?
Great question. So aside from housing authorities, we work with other housing providers. So like I said, Arbor Management, Action Housing, as well as service providers within those housing sites, American Healthcare Group, Presbyterian Senior Care, various organizations that are providing services within any housing site. But we also work with other organizations that are not traditional food distribution orgs, but that are places that food insecure individuals and families are going. A great example would be family support centers that many times are running daycare. So basically, when the parent goes to pick up the child from daycare, they get a bag of food to take home with them. So they're already going there. They don't have to go out of their way to get that food. In terms of frequency of distribution, that really varies. Our goal is to get them food as often as they want. That is a goal that took us a while to achieve. Obviously, there's some ramp up. So in the beginning, it wasn't necessarily all that frequent. It was maybe once a month. But now we are at most of our nonprofit partners probably at least once a week. Some of them almost daily. Some of the large housing sites get donations virtually daily. And in that case, those are smaller donations, so we're not sending hundreds of pounds of food to a housing site every day, but we might send, 10, 20-pound donations to a particular housing site that happens to be well-placed and have a lot of people at it.
Great. And then another question just came in. Do you have volunteer job descriptions? What materials/media do you use to recruit volunteers?
We've been really lucky with that. We started with Facebook. When we began, we were not a mature organization. We were a couple of people with a good idea. And so we first recruited our friends and family to pick up, and then sort of their friends and family got involved, and it spread pretty quickly. It's a really resonant idea. People do not like food waste, and they do not like hunger, and the opportunity to be part of that solution was something that really resonated with people. And so Facebook is where we built our base, with Twitter and Instagram providing support, but I would say Facebook was primarily. We received a lot of media. That certainly helped. Every time there's a news story, we get a lot of people downloading our app. That's a great opportunity, and it's also a story that media loves. Again, it's a very elegant solution. You've got people throwing away food. You have people that need food. You have volunteers taking it to them. It's ready-made for TV. So we use a lot of, we've had a lot of earned media that has helped us. In terms of volunteer job descriptions, I don't know that we have anything, written in. I mean, we have collateral that we use, and I'd be happy to share that with anybody that wants it. But there are basically two types of volunteers. One would be a regular scheduled volunteer. So, again, that person that goes to their neighborhood grocery store Tuesday morning, picks up produce, and takes it to the housing site down the street. That's the regular scheduled. And then the ad hoc, which are the sort of spur-of-the-moment donations that happen when they pop up on our app.
Great. If anybody has any more questions, please feel free to type them in the chat box, or you can press *7 to unmute your line to ask a question over the phone.
And I want to add, we've spent the last 3.5 years really building an organization and recruiting volunteers and donors, and it's been much like a snowball rolling downhill and gathering speed as it goes. But that doesn't mean that's what you have to do. If you have local donors that are willing to donate, and you have volunteers that are willing to do it, there's no reason why you can't just start doing this in your community and working to solve the problem. In terms of paperwork required for consumers, not for the individuals, we usually work with a with a provider, with a housing site, whether it's a county housing authority or Presbyterian Senior Care or something like that. We have an agreement for them to sign, and that's it. But the individual consumers, don't do anything. They don't fill out any paperwork. In terms of information that needs to be collected for statistics, a lot of organizations, we were actually just at a conference of food rescue orgs earlier this year, and a lot of places are not collecting data or statistics. We collect a lot of it. We really love data here. We love to get deep into it and have some number crunchers on staff, so we are really big on that, but you don't necessarily have to do that. Oh, yes. Yeah, we're paid. We're paid staff. I'm paid staff. We have actually 10 people on staff right now. We have multiple programs, though. Not everybody is on food rescue. Our operations staff, and by operations I mean the food rescue operations, we have 3 part-time drivers. 2 of those drivers also spend half their time in the office. We have me, that I oversee everything, and then we have somebody who is working on sort of managing the daily dispatch, nonprofit partner relations, at sort of the base level, things like that. We have funding. Our funding comes from a variety of sources. It's mostly foundation funding, although we get quite a lot of individual donors. We do have a truck, by the way. That's what our drivers drive, is our truck. That's for very large donations. We get pallets of food from some of the food distributors, so that's not for a small organization to worry about. That's something we sort of grew into. But our truck was donated by Andrew McCutcheon, who was previously on the Pittsburgh Pirates. So, there's a variety of sources, but mostly it's foundation funding and local foundations. Also, a lot of grocery stores and businesses that volunteer with us might make donations as well, like corporate sponsorship of events and things like that. While we're waiting for another question, see if there's another, I'll just let you know that our other programs, we have several other programs. One of them is to address the time issue for families. We won actually a contest and receive funding to create a kitchen to take some of the excess rescued food and turn it into healthy prepared meals that we'll then distribute to families in the community to basically answer the need for people that don't have time to cook. So a lot of the reason that families might rely on fast food or go to the corner store and get one of those frozen banquet meals isn't just about accessibility, it's also about time. So we are using excess food to create meals for those individuals. We are not affiliated with Feeding America. We are an independent organization. We do work with our Feeding America organization in Pittsburgh, though. And there's a lot of most food rescue organizations are actually not affiliated with Feeding America, but they tend to work with the Feeding America organizations. The system that the food banks have perfected is really amazing, but it is sort of not, it's complementary to what Food Rescue does, or more accurately, Food Rescue is complementary to what Feeding America does. Food Rescue currently cannot supplant the food bank system. You need that consistency of timing and of items. You always know that you're going to get X, Y, and Z from your food pantry. You can count on that. Food Rescue is not consistent in that way, except for bread. We always get bread. Oh, so our other programs, aside from the Millville Kitchen, which is creating those meals that we talked about, we have a program called Hidden Harvest, where we go out and we harvest fruit from city-owned trees. There's a lot of apple trees, some peach trees, mulberry trees, et cetera, around the city of Pittsburgh. We also do some farm gleaning, and that fruit, when it is appropriate, is donated to organizations or housing sites that are working with hungry individuals, or it might be turned into value-added products that is used as a fundraiser for us. So far we've had Wiggle Whiskey has been a great partner. They've created an apple pommeau for us from crab apples and a cider. And we also had a local beer brewer brew several beers as a fundraiser for us. Just one yesterday with some rescued fruit that was both gleaned off of local trees as well as donated from donors, but was a little too far gone for actual consumption. And he turned that into a lovely beer, which was launched yesterday. If you're in the area, you can pick some up.
Great. Well, thank you, Jennifer. And if we don't have any more questions, we'll end the webinar today. I just want to thank Jennifer again for joining us, and thank everybody out there for joining us as well. And have a great weekend.
Well, thank you so much. Thanks, everybody.